Hello everyone, this is Leah Beck. My presentation is on accurate patient identification, a Joint Commission National Patient Safety Goal. Founded in 1951, the Joint Commission is a not-for-profit organization which accredits and certifies nearly 21,000 healthcare organizations and programs in the U.S. Joint Commission accreditation and certification is recognized nationwide as a symbol of quality that reflects an organization's commitment to meeting certain performance standards. Their mission is to continuously improve healthcare for the public in collaboration with other stakeholders by evaluating healthcare organizations and inspiring them to excel in providing safe and effective care of the highest quality and value. Their vision statement is all people always experience the safest, highest quality, best value healthcare across all settings. For more than 60 years, the Joint Commission has been a champion of patient safety by helping healthcare organizations to improve the quality and safety of the care they provide. Their many patient safety-focused initiatives encourage and support organizations in their efforts to make patient safety a continuous priority. And one of those initiatives are patient safety goals. The purpose is to improve patient safety. The goals focus on problems in healthcare safety and to how to solve them. NPSG Comprehensive Manual for Hospitals states that the purpose is to promote specific improvements in patient safety. The goals highlight problematic areas in healthcare and describe evidence and expert-based consensus for solutions to these problems. Recognizing that sound system design is intrinsic to the delivery of safe, high-quality care, the goals generally focus on system-wide solutions whenever possible. This is the Joint Commission's main page. At the bottom right-hand corner, it listed National Patient Safety Goals as the number one most viewed item. On the revolving headline, it has People, Processes, Health IT, and Accurate Patient Identification. So clearly, those two topics are important to the Joint Commission. The Joint Commission's latest safety publication called Quick Safety is actually a newsletter. It's a newsletter with short reports highlighting emerging safety issues and providing timely information and suggestions for organizations. The link at the bottom of the slide is the latest newsletter, issue 45, released in October 2018. And it's a good read, so I highly recommend for you to read it at your own leisure. Patient safety goals. The following slides are from NPSG's PowerPoint presentation, which is widely used for educational purposes. National patient safety goals were established in 2002 to help accredited organizations address specific areas of concern in regards to patient safety. The first set of NPSGs was effective January 1st, 2003, and the Patient Safety Advisory Group advises the Joint Commission on the development and updating of NPS. The Patient Safety Advisory Group consists of widely recognized patient safety experts, such as nurses, physicians, pharmacists, risk managers, clinical engineers, and other professionals. They have hands-on experience in addressing patient safety issues in a wide variety of healthcare settings, and they advise the Joint Commission how to address emerging patient safety issues. The number one goal in NPSGs is improve the accuracy of patient identification. And FYI, since 2008, that is the number one goal. 2008 up to 2018, and actually 2019 is also the number one goal. Use of these two patient identifiers when providing care, treatment, and services. It applies to the following healthcare settings: ambulatory behavioral health care, critical access hospital, home care, hospital, laboratory, nursing care setting, office-based surgery. Acceptable patient identifiers include patient name and date of birth. The following are not acceptable: address and phone numbers, because we know that they can be changed, and they change every so often. Some clinicians use patient room number when they are referring to a patient, which is a big no-no. As we know, patients can be transferred or moved to another part of the hospital or another unit, and also patients can get discharged. Another topic is eliminate transfusion errors related to patient misidentification. And the following are the healthcare settings that this standard applies to: ambulatory, critical access hospital, hospital, office-based surgery. For more information on national patient safety goals, visit the Joint Commission website. Questions can be sent to the Standards Interpretation Group. I will be remiss if I don't mention the National Unique Identification System. As healthcare increases digitization, issues arises on data exchange and medical records exchange, which makes patient identification more challenging than ever. In the absence of a unique patient identifier system, clinicians can use patient's name and date of birth. However, there can be hundreds or thousands of identical or similar names placed in our system, so you have to be very careful, because if incorrect patient select incorrect patient was selected, and diagnosis or treatment is to be a huge problem. The challenge of accurate patient identification is not really new. When HIPAA was signed into law in 1996, it called for the Secretary of Health and Human Services to look into creating a standard unique health identifier for each individual in the U.S. 2 years later, however, Congress prohibited HHS from spending any money on the solution, and the ban has continued up to now. These are my resources, and I thank you for listening.